RSV, COVID, and flu are keeping kids out of school, parents out of work, and making it unable for us to gather for important times with our families. It's important to know what we can do to keep the viruses from interrupting our holiday celebrations. This segment is sponsored by the College of American Pathologists, and joining us with more is Dr. Emily Volk, president of the College of American Pathologists. Dr. Volk, thank you so much for joining us.
Yes, thank you.
Thank you.
Yeah, Dr. Volk, what exactly is RSV and how does it spread?
RSV is a common respiratory virus that is prone to attacking the small airways, and it can present as a mild cold, but in some people become a very severe illness, really resulting in a lot of coughing and difficulty breathing. In small kids, they can start taking deep, quick breaths, and they can stop eating, all things that are worrisome to parents. Usually this is an illness of infants and young children, but it can affect adults, especially the elderly.
Yeah.
This is an illness that is very easily spread. It can be spread through sneezing and coughing on each other, right? But also it's one of these illnesses where the virus will live on a surface. If someone sneezes on a countertop or doorknob, touches it, that illness can be spread this way as well. So very contagious illness without a vaccine available for it and without a specific antiviral treatment.
Yeah. Why do you think we're seeing a surge in RSV cases?
That's such a great question. We're really witnessing the payback of an immunity debt. And what do I mean by that? Over the last couple of years, we have done a great job of doing social distancing, limiting contact between folks in big groups. And as a result, we've been able to really control to a large degree the COVID-19 pandemic and also slow down the spread of other respiratory viral illnesses. So we had fewer infections, not only of RSV, but other kinds of illnesses. So less infections means less immunity. And now that we're getting back together without the masking, coming together in larger groups, we're seeing folks who don't have the immunity getting more severe infections.
Yeah, that makes sense. So you've just listed some symptoms, but what is the difference between RSV, flu, and COVID symptoms?
There is a lot of overlap between COVID-19, flu, and RSV. And really, as a pathologist, I can tell you the best way to tell the difference is to get a test for the virus. And you can get for the viruses, and you can get that at most emergency departments or urgent care centers.
Yeah.
Absolutely. You know, holidays are coming up. Families may want to travel. What precautions do we need to take, Dr. Volk, this holiday season as we travel so we can be safe?
Well, I'm going to tell you about vaccines. Even though RSV doesn't have a vaccine, we know that COVID-19 and seasonal flu both have safe and very effective vaccines available to folks right now. With the COVID-19 vaccine, only 68% of Americans got that first vaccine. And then of that 68% who got that first shot for COVID, only 50% got the second shot, the booster, and only 13% got the most recent, most effective booster for COVID-19, the one that protects you from the Omicron variant circulating right now. Also, we have a lot of opportunities for seasonal flu vaccine. Only about 40% of Americans have gotten that. So you can get the COVID-19 and the flu vaccine on the same day, and that will go a long ways to protect your communities and your families from getting sick this holiday season. You'll want to stay out of hospital emergency departments right now. Our hospitals are quite full, and it's not the way you want to spend your holiday season.
Yeah, absolutely. Dr. Volk, thank you so much. Definitely all the things that we need to know, such as we're getting together for the holiday. Thank you, Dr. Volk.
Yeah.
Thank you.
We ran into this a little bit this week. We had a sick kiddo in the house this week, so we were like testing for COVID and seeing what's happening. So I think it was just a quick virus, but there's just so many things happening. And, you know, kids are small, they're sneezing, they're hugging, they're playing, and it gets tricky.
Yes, it absolutely does. That's why we need advice from the pros right there. And thanks to the College of American Pathologists for sponsoring that segment.